YouTube also. Simultaneously, we will be live. Yeah, it is now streaming live on Facebook and YouTube also. Okay.
Right.
And hi everyone, those who are already present and also present on Zoom, Facebook, and YouTube. Uh, Welcome to this webinar. Today we have with us Dr. Sudipta Thakur. He has done his MD in psychiatry and is now a practitioner on mental health in homeopathy. We are really eager to learn something new from him regarding this COVID outbreak and our mental condition, how we should go towards these 21 days and how we can get most out of it without having any kind of panic or anything. So before starting, I would like to ask our audience if they can already have their chat option in different media. So if they have any kind of questions, they can ask. And before beginning, I would like to ask Dr. Sudipta Thakur to introduce himself. Yeah, Dr. Sudipta Thakur, please.
Hi and good evening to everyone. I'm Dr. Sudipta Thakur. I have graduated from Calcutta University and post-graduation from BRA Bihar University in psychiatry, and I'm a mental health professional in homeopathy. Today, just in a haziness, I mean, in a very short time, we have been prepared for this meeting. So I'm hopeful within this short period of time, we'll be able to discuss some important points and regarding the mental health and social behavior, which is concerned to the COVID-19 currently we are going through. Now,
yeah, thank you. Thank you, Dr. Thakur, for the introduction. And regarding today's topic, actually everyone is aware that we are going through a very trivial, very trying times. And everybody is getting panicked. Everybody can actually smell panic even through phone also. Okay. Then I would like to ask him why people are getting so much panicked over COVID-19. Dr. Sudipta Thakur, please.
if I say the psychosocial aspect of COVID-19, in just two words it can be finished. One is panic and second one is stigma. These are two major factors that is concerned with COVID-19 right at present. So first we'll come to the issues. This is panic. Why the panic is there so much around this COVID-19? To be very precisely, you can say, it's a little interesting analysis you can find. See, for anything happens in the world, you need a reason for it, right? Anything is dropped, so you need a reason why it is dropped. There is a gravity. Now for the disease spread also, we need a reason why the disease is spreading, who's the reason for the disease, like this. For the COVID-19 disease, it is the virus definitely. Everyone knows it is the virus. The uniqueness of the problem in this case is the transmitter of the disease is human being. This is the major factor which is causing all this stigma and panic. This is one of the major factors. See, if it is about malaria, we'll blame to the mosquito. This is the carrier. This is the thing which has to be eradicated. Mosquito has to be eradicated. Now, this has happened to the human being. So, our focus from the virus has been shifted to the human being. Most of the persons all over the world, it's not in India, all over the world, since the very beginning, people are pointing the person. They are looking it as a person who spreads the disease, like that. It's not the virus which is getting spread to human. It's the person who is spreading the disease, like this. This is a thinking process which is going on. Now, WHO is quite aware of this thing. From the very beginning, they are aware of this thing. So they have issued some guidelines we'll be discussing in length in our latter part of discussion. This is one part of the panic. Second part, the reason for panic is you can say the activeness of the governments. The number of deaths and number of disease cases that is coming every hour through the websites, through the web portals, through SMS, through uh, this website, WhatsApps, through Facebook's updates. You are getting to know what is happening in Italy. You are getting to know what is happening in Wuhan. You are getting to know what is happening in Australia. Every hour you are knowing this. So whatever happening in the far part of the world is actually making a sense of anxiety within you. And knowing that there is, people are saying that there is no medicine and no prevention, and we are absolutely helpless, like this thing they are saying. This is also making people quite anxious. Now, this is the reason you can say why the panic is.
Yeah. Thank you, Dr. Thakur. Actually, you have rightly pointed out these things that we are getting targeted. The person is getting targeted, not the virus mostly, as a social target or anything. So we understand that being alert and being panicked are completely different things. Okay, what is your take on how we should not get panicked but should be alerted? What is your take on regarding this?
See, it is the human behavior actually. It is being alert or being panic, whatever. If you explain the human behavior, whenever there is a chance of attack on human being or any animal, you say animal or plant, there's any chance of attack, our autonomic nervous system, it starts acting. We become aware of the situation that something bad may happen to us. So this creates an sense of anxiety within us. This is anxiety.
Stress
This is
and
autonomic
anxiety.
nervous system reflex only. Now, this anxiety level, when it goes beyond our control, when we can't control this anxiety, this becomes fear. And when this fear, it becomes a causeless thing, and we lose all of our hopes. We don't have any hope, but we fear. That condition creates the condition of panic, right? So panic and alert, it actually getting diverted from the point of fear. A fear plus our mind is judgmental and we can take preventive measures, etc. from our end, that will turn into alertness. And a fear without any judgment power, without any solution, it will go into panic. So this is the basic difference between being alert and being panic. Alert is you have a power in yourself to manage the situation. And panic means you just fear. You can't, you are helpless. Helpless and fear, both combination becomes into panic. This is the difference between alert and panic, right?
Yeah. It is like just thinking and getting anxious. Yeah? Normal thinking and
Right.
getting anxious.
It is only, I will say, level of thinking, I will say.
Yeah. And another thing I would like to point out that in our lifetime only, we have already seen, we have gone through different phases of social behavior. Like you
Right,
see,
right.
in pre-internet era, we have seen one kind of social behavior, and in this internet era, we have seen different kind of social behavior. Previously, social would mean something else, like getting on with different people, getting together with family and family friends. And now social means social media. Okay, we actually used to cut
Right.
away from different our family members, also from other social members also. But now, during this COVID outbreak, whatever we have seen a different kind of mindset. People are getting social behavior is somewhat changed. Okay, perhaps you have also noticed these kind of things, and I would like to ask you as a as a doctor also, as a observer also, how you are thinking, how this kind of social behavior is changing during this trying times of COVID-19. Dr. Thakur, please.
Dr. Shuman, I will not say that there has been much changed in the social behavior due to COVID-19. I will say the bad parts of the social behavior has come out. It is now coming in front of you. As the crisis period has come, it is a time to examine yourself, examine ourselves, what we are doing, what is our humanity level, and what is the level of our empathy, and what is our judgment power. This has come into kind of acid test right now. So social behavior, I would say there has been much change in the thing. Basically, whatever happened in the pre-internet area or the post-internet area, there is judgment power, I will say, is quality of judgment, the quality of empathy. Again, I'm saying empathy and quality of humanity. These three words, this is same. Now, how people react on this thing, that is, yes, at the time of epidemics and crisis, it is quite difficult. Like people are now saying it will be a kind of what to say, this Darwin theory, they are now saying the fittest, existence of the fittest, like that. I'm not that much of unhopeful. I'm very much hopeful that very soon people will learn that whatever remains within us, whatever possibilities of living is, that is within the community only. And behavior change has not been that much, but whatever bad part of the behavior has come, that has to be, win over the situation.
Yeah, suppose like social behavior like Dr. Thakur, social behavior like panic buying.
Yeah.
You can say people. I have seen that people are buying so much things that is not needed actually. Hundreds of kgs of rice or anything. Okay, so this kind of thing.
This is a kind of, this is character. It is this was inherent within us. It's not that this is something new has come to us. This is only our behavior has been some. I will say some characteristic of our behavior has come out in this form. People was socially isolated. People was socially isolated. Their mind, their everything was socially isolated. And when this crisis period came, they are thinking about themselves only. This is one of the reasons of the panic for personal basis. I will say there are few characteristics. Yes, there are few instances of panic is coming around. And panic and both stigma, it's a mixed kind of thing. You cannot differentiate from one each other. It's a mixed kind of thing is coming. People due to panic is become stigmatizing others, and people have a habit of making stigmatizing others. So their issue is now panic. It's like that. Panic buying is one of the examples you have said, rightly said. People are buying hundreds of kgs of rice and hundreds of kgs of sugars, and making a ration of 3 months. Although there is no scarcity of food in the country right now, and there is a government also to manage this situation, still people are scared. People are quite scared because one of the reason is this social media myths and this kind of I would say modified newses, like these things are happening, the rumors which is spreading across the social medias. This is causing actual this panic buying and all this thing. So yes, definitely this is hampering the normal thinking process. And people have forgotten, if I purchase 100 kg of rice, the person who cannot buy more than 1 kg of rice for his family in a week, what will happen to him? People have forgotten all those things. So definitely these things are coming away, and we have to conquer over this. We have to change this behavior. We have to make people understand. This is at the social level, I will say. Personal level also, people are very much anxious. People are having a sore throat. They will be calling the doctor. Am I having COVID-19? People are having a kind of evening rise of temperature, small rise of temperature due to these seasonal changes. They are calling the doctor, yeah, if I should be getting changed, getting checked. Then it is in the social level also. In the neighborhood areas, neighbors are seeing at the person who have returned from other states, person who have returned from foreigners. They are like taking, this is not a people, he is a germ spreader, like that they are looking at. There are government guidelines when to go to the clinics, when to go to check up. There are strict guidelines, quite well written guidelines.
You can say, you
But
can
people are
share,
not following that.
if you have any kind of guidelines, WHO guidelines, or any kind of ICMR guidelines, or any guidelines from authorities, you can share. You can say share your screen also. Okay, if you have anything like
See,
that
in
will
that case,
actually
I'm to
that will actually prepare
show
us
you. I will, yeah,
in this
yeah.
crisis period. No, mentally prepare us. If we have any kind of guidelines during this period, what should be,
We
and
have to be.
yeah.
We have to be mentally prepared. We cannot deny the situation. We cannot deny the situation that it is a crisis period. We can't deny that. Okay. Now, thinking that this is a crisis period and we are helpless, it is not going to help us. Huh? So, what do we have to do? We have to assess what is the level of, I will say, what is the level of, hello?
Yeah, it's all, you are audible.
It is audible. Okay. Now we have to access what is the actual dangers. What is the actual danger? Not assumption should not be like that. This may happen. The world may be end. There may be a riot. Like not. We should not assume those things. We just take the points. What is the situation and what we are told to do. We have been told to remain in home, so we remain in home. We have been asked to keep our hand hygienes. We have been asked to keep 2 meter distance from personals. We have been asked to not to touch our nose and eyes or mouth with our hands. We should not do that. These are the things which is being asked. We are being asked, and we should follow it. Whatever we are being asked by the experts, by the governments, we follow it, and that is the maximum thing we can do, and we'll do it. After that, what may happen and what may not happen, we should not concentrate on those things. This is number one. I'll show you a WHO guideline. Actually, we have short time, so I'll show you a WHO guideline. WHO guideline was issued in 12th of March 2020. This was given to the all United Nations countries. So I'll show you that. In that guideline, you will find that WHO has beautifully, they have stated what to do and not to do. This is the mental health guideline. Yeah, it looked like this. Mental health and psychosocial considerations during COVID-19 outbreak. Right? Introduction, and then categorically they have divided the guidelines for the general population. You can find this is the general population guideline, and then they have given it for the healthcare workers. They have given this advisory to the team leaders of managers of health facility, and then to the care providers of the children, and then to the older adults and care providers. So it is already there. We can just make a small discussion about the thing, and you can go to the WHO site, the COVID updates, and you can download this thing. Okay. So this is the guideline that WHO given. I will concentrate on 3 parts only today. That is one for the what the general population should do to avoid panic and fear, and what should be the management for the children and the older persons who are the most vulnerable part of the society for this COVID-19, right?
Yeah.
So I will start general population. First thing, that please do not identify a person with the disease. Please do not identify a person with a disease. That is, you have a person, he has a name, you don't identify he is a COVID-19 case or he is a spreader of COVID-19 case. Not like that. You can say he is Mr. X who is having COVID-19 positive. You should say in that line. There is a big difference. Although it looks same, Mr. X having COVID-19 and COVID-19 case Mr. X, there is a big difference. Although it looks similar. If we point a person with the name of the disease, it is simply isolating the person from all of us and simply stigmatizing him. This is happening. This is happening. Even in the news medias are not that much of responsible to follow these guidelines.
Yeah, we have already seen a few days ago, few days before, somebody just posted someone's picture on social media and said that this is the person who has died of this disease, COVID-19. We should never do that. We should never encourage anybody doing that. And yeah, this is a very bad thing. Exposing anybody with.
I'm telling you why people are doing this. I'm telling you why people are doing this. People are actually doing this out of panic, definitely no issue, but out of I will say lack of empathy and knowledge also. People are thinking that by spreading this thing, people who are irresponsible, they will become responsible out of fear of social stigma. But actually it is not happening. The opposite thing is happening. Whenever any one patient is getting stigmatized over the social medias, all the person who is likely to develop the symptom, they are just simply hiding their symptom out of social stigma, and they are denying to disclose their symptoms to the health authorities. And definitely this is going to spread the disease further in a speedy manner. If a simple reason, if a person who is having the symptom or have a history of travel or a history of exposure is hiding it only because out of stigma, so what will happen? He will simply spread the disease. Yeah. So this is the reason why we should destigmatize. We should destigmatize COVID-19. COVID-19 is a disease like other viral diseases. It is also a viral disease only. And a human being who is getting in contact with others and getting the disease, he is not a guilty person. He is not a guilty person. He is simply a patient. By unfortunate reason, he has become infected. So we should be more people-centered, not disease-centered. We should be more people-centered. So just it can be finished in one word: be human and be empathetic. But still, we are recording to explain this thing to people. Why stigmatizing a patient is not going to help us anyway. This is the reason for explaining all this thing. And
even in our apartment, I have seen some persons are actually trying to stigmatize some persons. Those who are going out, suppose somewhat it is okay, but in a tolerable limit. But it should never be stigmatized as a general. No, suppose we can forbid somebody from going out, but stigmatizing somebody is always not to do socially, specifically. Okay. And
how should we become aware but not stigmatizing or being panicked? I will tell you what should you do. Suppose we have a person in your apartment or your neighborhood who has returned from foreign countries.
Yeah.
Now you have a fear that person can be infected and can spread. So what you will do? You will ask the police to get this person tested. What is actually happening? No, please don't do that. He or she is your neighbor. Simply call them and discuss with them the situation. This is the situation, and I know you are being isolated. You have been advised to get isolated. You know these rules of isolation. You should be in a separate room. You should not be using the utensils of others. You should not roam around in the home. Are you aware of this thing? You are not. How is your health? How is your mother's health? You talk as a neighbor. You just talk with them and make them aware of the situation. They would also know that we have a moral support. They won't hide their disease, right? And they won't stigmatize also. And your problem that whenever this symptom is arising, you go to the doctor. You make a friendly discussion with them. So you will be also aware that what is the situation of that family, what is the situation of that person, whether any risk of contamination is there or not. and this person will also get a mental help from you. It will make them strong and will make them to take the right decision at the right time. That will help us also. Huh? So this is the way of dealing it, not being panic, no calling the political leaders that this is the person who has come from foreign countries, get him tested now. No one is getting tested without any symptom, I tell you. As a government guideline, a test will be done whenever anyone is having the symptom. People are sending person to the government hospitals to getting tested. The person who was been advised to be in isolated condition, they are now being forced to being exposed to hundreds of people and being in line one by one in the hospital, and like this contact chances are getting raised only because of misinformation in the people. So there is a big communication. I mean, there is a government has now concentrated on the you'll say isolation. It's not isolation is not going to do unless people understand why this isolation is and how they should behave. It is not going to help. So, as a common citizen, as a citizen of this country, it is our responsibility to get the correct knowledge, from the correct source and spread it to the person. Get the correct knowledge from the correct source and spread it to the community. 3 points we should follow.
If our audience have any kind of questions, any question they can ask there, or they can raise hand. We can. They can also be allowed to talk to us, talk to here in this webinar only. Okay, they can ask. Just raise their hand, or just ask the question in the chat panel. Somebody asked. Anonymous attendee has asked. Do you think the social distancing is practically possible in our country? Because people are getting exposed when they are in market, as they cannot keep distance always. So, in your opinion, what can be the right mode, especially when there is scarcity of mask and protective equipments?
There is good question. Good question. Every good point has been raised. First of all, is social distancing possible in our country? Please believe in yourself that yes, it is possible. Unless you believe in yourself that it is possible, it is not going to be possible. First, you believe that it is possible. For last 1 week, we are trying to do this, and quite a bit we have been successful to not get out of home. If I can do it for 1 week, we can do it for 2 weeks also. So yes, it is quite possible. It's not about our country or Australia or Italy or America. It's not like that. It is the people concerned is everywhere same. Okay. And government responsibility was to make you aware, and they have made it aware. No one can say that you are not made aware. There is a problem of rationing and problem of foods, all these things. Government is looking at that part also. Maybe we cannot have the same kind of standard of living when we are having 2 weeks back. It is a kind of situation which just came to us after 2 generations. Our generation or our father's generation, they have never seen kind of epidemics, this kind of pandemic situation. They have never seen. So this is the kind of situation we have never faced. So something management we have to take which we have never done. It is very much possible in our country or anywhere if the people want it, if the community want it. Secondly, coming to the scarcity of mask and sanitizer. This scarcity has, yes, we are not that much of prepared. We are not that much of prepared how much we should have been. When the outbreak was coming in the month of January, we should have been aware of this thing. I mean, our administration should have been aware of this thing. Okay, there has been a little bit of late, but instead of that, scarcity of masks and sanitizers in the government hospital is also there. The PPE models are not there because people has panically buyed it. People has panically buyed it. Who says that wearing a mask will save you? No one says that. There is a particular guideline for the mask. I show you for your understanding, I'll show you this thing. What is the guideline? I show you that. This is a Government of India guideline. There is a WHO guideline when and how to wear the mask. Okay. See, I'm opening it. See, this is the guideline. It is clearly highlighting everyone need not to wear a mask. Everyone need not to wear a mask. Only to wear a mask if you have a symptom. That is to protect others. You are wearing the mask. If you are having a symptom, cough, fever, or difficulty of breathing, anything else, then you are doing this to protect others, not to spread the disease. So save others. You are wearing the mask. Second, if you are a caregiver of a COVID-19 patient, you are getting in touch, you know that you are going to get in touch, like the doctors and nurses are getting in touch with patients voluntarily. So they have to use the mask. So this is the reason, this is in simple, this is the reason. You can download it from the Ministry of Health and Welfare website. There's care guidelines. There are guidelines in the Government of West Bengal Health portal also. Or you can download it from the WHO website also. Everything is there. So this is, everyone does not. Regarding the sanitizer you should use only in the place where there is no scope of soap and water. It's not in home also you always rubbing your hand with sanitizers. It is not going to give you any special help. Simple soap and water and repeated washing with it, that is going to much more helpful than sanitizer. Sanitizer is a compulsion to buy when you don't have any scope of water. Suppose you are in hospital duty, you don't have time to wash and repeat all these things. One by one, you have to see the patient. So you need the sanitizer. You are in a road for 2 or 3 hours. Now you are not road, I know. So you have to use the sanitizer. So neither mask nor sanitizer is a problem actually. This is a panic attack, which is actually the problem. Now, if you don't have a mask, you'll say, if I don't have a mask, what should I do? This is a vital question. If you don't have a mask, simply fold a clean cloth, like a rumal or something else. You fold it, you bind it in your head, and you don't spread directly. You don't sneeze or you cough directly in someone's face. You maintain 2 foot distance. You cover your hand with mouth with this like this, and you cough this. And then you clean this piece of cloth every day in Dettol's or in bleachings like that. You wash it with that, make it decent, make it sanitized. So this is going to help. It's not that you need to get scared that there is no mask, there is no sanitizers, what we'll do. There are simple ways you should maintain and it will help you. Right.
Anurag on Facebook has raised a very good issue. Like every people is thinking that if I maintain safe distance, okay, there will be no harm, and they are going out, they are going to the market, to the religious places, okay, and gatherings are happening, okay. Is there any solution for that?
Yes.
Because people are
Yes.
thinking that if I keep safe distance, but whenever people are gathering, there is no safe distance, okay. Then how it can be prevented? Or is there any solution?
Not to get gathered, not to get out of the there. Now there is no question of getting gathered. There is a strict laws. There has been lockdown from the central government, from the state government, everyone. There is no point of getting out without any reason. Only the person who is involved in the essential services, they risk their own life, their own family life, and they are getting into the service. Just respect them, and to save those persons, please don't get out the home. Out of only we are getting sick. There are we can discuss what to do in home and how to get out of this anxiety. We can make discussion on that also. But please don't get out of the home. And social isolation, I again say it is possible, very much possible. If we become aware, our community become aware, it is very much possible. It is not only out of fear you don't get out of. Yes, you are fear, that is okay, but it is your responsibility also. Please don't forget your responsibility. Be responsible and please don't get out of home without any reason. And when you
In
are
spite of
going, there is nothing
restriction, actually,
that you are going
in
to gather
spite,
and you are having mask or PPE model, so you won't get affected. It is not like that. You may get affected in a chance. You don't know when it may happen. You don't have control
actually,
of the virus,
yeah.
right?
Anurag, strict
Any
laws are there. Yeah, like he is asking that in spite of restriction, it is happening. Okay. Yeah, I have already seen it on live in from different places that it is happening. That is the reality. But it should not be, because if we are aware, one of the main uh, motive of this webinar also is that people should be aware. People should be aware, but should not panic. Okay. Anurag, you listen this. Ki suppose somebody is going out, okay, he is endangering many other lives, not only him, not only his family, his or her family, but the society at large. It is so, if somebody is going out, not only it is responsibility for him, also the responsibility for law and order maintaining persons, it not to happen. It should not happen. It should not happen. So if we holistically see that everybody is aware, then nobody will risk his or her life or any other's life he or she loves. So it is a matter of education also. If we are educated enough, then we should not do this. And there will be minimum activity from the law authorities. They don't have to do much. If we are aware of this, if we are aware of the danger, then it will not happen. So this is the only solution, perhaps, ki, making people aware of the impending danger and how to avoid that. And if it is not possible, then strict law and order should have to be in place. Okay, perhaps that answers your concern. And many of my patients also are asking about, like they are anxious, ki what kind of food, like Jayjit Ghosh has asked, what kind of food we should eat this time. We are very anxious, ki this may reduce our immunity, or can you suggest something that can boost our immunity? Okay, like while lockdown in home, and do we need to consult doctor for test, or what are the symptoms come to when 4 or 5 members in the family all are in good health? What do you need to maintain fair distance in the family also? Okay, like Chandranaran Kairi has asked, it is about building the inner immune system in the optimal level. Yeah, it is, of course. And also by health, we mean physical and mental health both. So mental aspect we are dealing with, so that if we have mental aspect is okay, then also we will have physical aspect okay. But the thing is that for physical health also affects our mental health, that we will have to take care of. Okay, what do you say, Dr. Thakur, regarding this, like regarding
I'll
food,
say, I will
regarding
say, I will say, yeah, there is nothing to do very special for the immunity. You do your you do your regular job. First, you take all the foods that has been advised, not advised actually, that you used to take in a regular manner. You take that. Do not reduce your protein content. Do not reduce your protein content out of fear of contamination. If you have like to eat meat or fish, you can have it in a well cooked condition. You cooked it very well, you wash it very well mannered, you cook it in a very well mannered, you make it boil for 20 or 30 minutes in a well. So nothing is going to harm you after that. So you don't reduce your protein content, number one. Second thing is that you make 30 minutes of exercise, make 30 minutes of daily exercise. You make a habit of 30 minutes of mild to moderate exercise. Who don't have any habit of making exercise, you start doing now. COVID-19 has, as we are saying, that it is the time to reform your mind also. It is the time to reform your behavior also. You make these healthy behaviors which we avoided for years and years. It is the time to rebuild those behaviors. You start 30 minutes of mild to moderate exercise, slowly increase the pace. Any whatever your age may be 8 years or yours may be 80 or 88 years. Everyone should start mild to moderate exercise for 30 minutes in a day. You take healthy foods and you do recreational things in your home or your family with your family members. recreational things to keep your mind healthy. This is the things that is going to make you help in your body also, increasing your immunity also, and increasing your mental status also. This is the second thing. Jajit Ghosh, I can see he has asked a very technical question, I'll say, very important question, which is yet not come. He's saying when 4 or 5 members in family and all are in good health, do we need to maintain fair distance and not to share our using materials for others? If you can do that, Jadit Ghosh, I will say, this is the best thing. If you can do this, this is the best thing. But it won't be possible for you always because you may have a children, you have your wife, and you may have a small room. So it may not be possible always. But it has to be concentrated. Like still now, it has not come into public awareness campaigning. That is, the aged persons all over, the aged persons are the most vulnerable group. Aged persons are most the vulnerable groups. These persons are easily should have get infected if anyone in the home is infected. I mean, person having good health and young age may be asymptomatic, and without knowing, he may spread it to his aged parents or his aged grandmas or grandpas. This may happen. So time has come. For the time being, say for 3 weeks or 4 weeks, you keep your parents or grandmothers, aged persons, isolated. Even all of your family members are healthy and the grandson or grandmother or grandpapa, they are healthy, you keep them isolated. I mean, isolated, physical isolated. It's not like that you lock the door and you don't talk to them, not like that. You keep them isolated. Like home isolation, the person should have a separate bathroom and a separate bed and separate room. No one should enter there. You maintain all these things and don't share the food with them. Don't share the utensils with them. Make them everything separate. Like it's not very tough thing. If someone in our home gets a chicken pox, how do you maintain isolation? You just think everyone is having chicken pox, so we have to be safe. This person, your aged person, you think they have got some infection, so you have to keep them safe.
Yeah.
Now,
Yeah.
make understand this thing is a very, very tough thing. Making your parents understand this situation is very tough thing. So there are a few guidelines, WHO guidelines, how to make them understand. First of all, in a clear language, and in a short way, you make them aware of the situation. Those are healthy, you can make them. Those are demented patients, those are having a dementia patient in his home. It is very much tough for them. So it is the guideline for them also. You make them aware of the situation in a very clear and very short message. And then you slowly get them the habits or habits that they have to be adapted now. Give them a kind of directive. First, you make them aware, then give them the kind of directive what they should do and they should not do. Then you make a small follow-up practice. One day may not be helpful, but you try doing this because again, I'm saying these aged persons are really a vulnerable group, right?
Yeah. And no more question, perhaps. Somebody, Mr. Bishwajit has asked, like testing kit. He has some specific question, like testing kit, where he somewhere he has learned some testing kits are there in US where within 5 minutes they will get result. Whether that is available in our country or not, he has asked. As far as I am aware, it is not available in our country till now, and the latest in 3-4 hours they are getting result currently. Okay, and
Right. ICMR has permitted one Indian company to get it. Previously,
yeah, in
it
Pune,
has
in
imported
Pune.
it has to be imported. Now it is getting prepared in India itself.
Hmm.
10,000 yesterday news. 10,000 kit has come to Calcutta also from
Yeah,
IIT
yeah,
hospital. It's
yeah.
come. So I think think within time they will be prepared. Testing is very important. No doubt testing is very important. Scarcity of kit is also there, no doubt. That is the reason we have to be isolated more. We have to
Yeah.
practice the social. It's not isolation. I will say it is a misnomer. It is social distancing actually.
Yeah,
Isolation,
social distance.
you will not talk with them. It is isolation. So isolation is the wrong word. I will say it is a social distancing that we should have, and that is also physical distancing, not mental distancing. This is a physical distancing that we should uh, be maintaining. And regarding the kit, when a person should get tested, it is a clear guideline that whenever person is having a symptom of COVID-19, then only the kit should be used. It is a very guideline. So you don't force a person or a neighbor to get tested because only you want to get satisfied. There is no scope of such test.
Yeah, that is very important. That is very important in this scenario because some people are saying that person should get tested without having any clear cut symptoms or symptomatology. Okay. And another thing, Mr. Query has asked, what should be the psychological toughness we have to have, because most people are actually distracted through various kind of media and they are getting panicked. So what are the points of mental toughness we should be maintaining during this period? Thank you, Mr. Query, for asking this. Yeah, over to Dr. Thakur.
It is also a very fact that this has happened. So my clear cut direction is, please do not follow multiple sites or portals where every hour you are getting report the increase in number. Please do not follow. This is a simple solution. You want to get the update. We have a ministry portal, Ministry of Family and Health and Family Welfare.
Yeah.
You go to that portal. Every day they update the numbers twice in a day, once in the morning 8 a.m. and in the evening 8 p.m. You just once in the day, you see the situation. Every hour, I know people are following some COVID-19 portals, private portals, where they are putting the data, they are updating the data every 4 hours. They are taking feedbacks from newspapers and portals and then getting updated. It is not, first of all, this is not authenticate, number one. Second one, this is not going to help you anyway except raising your anxiety. You are taking the count every hour. It is not going to help you. Second thing, there are myths and rumors that is running around the social media websites. So you don't even bother about this thing. You don't look any corona related post. You don't look at it. You just make a habit of looking at the government portal on a daily basis, on a routine time, make a routine, you follow it, and you don't look any other, don't discuss this thing with any other person. This will happen. Someone will say this has come down to your area. Some will say there that many person is roaming around your area. This is going to affect. This is going to take this medicine. It will be safe. Don't look at all these rumors, all these things. You just follow the government guidelines, and you will be safe.
Thank you. And another thing, whatever I have found, the Minister of Health and Family Welfare, Government of India has already established one communication link through WhatsApp. That number I am sending you 90131 51515. 90131 51515. That is from Ministry of Health and Family Welfare, Government of India. You save it on your phone as a WhatsApp number, and you can ask any kind of questions regarding this, and they will give authentic answer through their robotic chatting system.
Chatbot.
So yeah, chatbot is there, and from Ministry of Health and Family Welfare, actually they have done it in collaboration with WHO. So this is the most authentic source of information you can get over WhatsApp. So I have already told you 90131 51515. Just save it and it will be activated. Just save
There
it.
is
And
one suggestion also. please do not forward any message you get and you forward it to your group. Please do not do this thing. You
Yeah.
look the authenticity message. You see one of the character, how to identify the rumor. It is a rumor or it is a fact. So how to identify? This is one character is that rumors don't have any source. You won't find any source. In the rumor post, you won't find any particular source. If there is a source, you go back to the source and you can make a fact check. So better you believe on the printed media or the news portal, not on this WhatsApp and Facebook post. You don't believe on this, please.
Yeah, and during these trying times, I would like to ask everyone who is admin of the WhatsApp group or Facebook group or anywhere, any social media group, they should lock down their group in such a way that only moderators or administrators can send messages regarding this kind of diseases. So everyone they will be safe from legal point of view, and also they will be acting as a socially responsible person. Okay, and we are near ending of our webinar, and I would like to ask Dr. Thakur that what are the points in brief you have learned during this pandemic of COVID-19? It is a learning phase. No, after a few years, we will be able to see that if we survive, then the period of social isolation, period of unity in our country or unity as a whole all over the world, okay, na, we have never seen in our lifetime this kind of unity, okay, unity over
Right.
diversity, okay. Yeah,
We're
these are
united
the
by
things
fear.
that, yeah, united by fear maybe,
Yeah.
but the thing is
But
that
we
this
have to
kind of
convert it to
unity,
united by empathy.
empathy, yeah, yeah, that is the, that is very much required now in our world scenario, okay. But what are the points you have noted down, whatever the point in your mind you have learned during these trying times of COVID-19?
See, COVID-19, I will say, apart from all its bad things, it had even some good things also. It has put a reboot button to our mind. It has put a reboot button. It has made a complete stop to our rat race. It has made a complete stop to our hasty minds. And it has given a chance to rethink what we are and why we are. It has given a chance to think what is my role in the community and what is my role in my family and what is my family is to us. It has given us a chance. So you rethink it, you make your time to understanding all these things. This is one thing. And second thing, again, I will emphasis on what you do and what you don't do. This is I will like to end my conversation with that. What you don't do, that is anything that makes you panicky, you do not follow those things. You become aware of the situation and what you should do from the authenticated sources, and you do not follow or spread any rumor. This is one. Take care of your mental health and your family's mental health by sharing positive news. Positive news. You check on, don't check on how much person is getting infected. You check on how much person has got recovered. You see the numbers, you'll be encouraged. This is the percentage of death is very low. It is only spreading very speedily. See, suppose if it is not a coronavirus, if it is simply an influenza virus or an allergic rhinitis, if everybody in the world is suddenly starts allergic rhinitis, which is not harmful that much. So you see how much scares will be there. It is also like that. It is quickly spreading virus. Eventually, we hope it will be taken under control. We'll be able to control it. But till that, please maintain all the guidelines that is being shared by government. Okay, and please respect all those are fighting this war or you, that is the healthcare workers. Please take care of their social and mental health also. There are reports in the news medias that doctors and nurses are being forced to leave their rented houses, or they are getting isolated in their own neighborhood because they are serving the COVID-19 patients. People are getting this out of, I will say, inhumanity, then out of awareness, I will say. So please learn the things, be empathetic, be human, then the whole society will be safe.
Yeah, government has already taken initiative. Those persons who are actually treating COVID patients, no, COVID-19 patients, actually they will get isolation period of 14 days. After then only they will be transferred, especially the nurses, those who are treating, those who are helping getting the patients treated in hospitals, in different hospitals. They will have to pass through an isolation period of 14 days. Then only they will be able to meet, and that is for safety of all. But the doctors or persons who are actually treating the patients, they are very much aware of the danger, impending danger. So they are taking precautions as far as possible. And the time period of lockdown, we are not sure. We are actually not sure whether it will be extended after 14th April or not.
Depends on the
But
situation.
yeah, it depends on the situation, because the phases, how long the actual phases will pass over, third phase, fourth phase, these are the phases. Actually, epidemiologists will be guiding us. Yeah, what are the phases we are passing through, and according to the duration of that phase, we can predict this is the amount of lockdown needed. These are the this much days of lockdown is needed for this phase. So we cannot predict right now, but we may hope that if we are inside our house, if we help our society not to spread the virus for our own wrongdoings, then we will be able to shorten the period of every phase. Okay, suppose the phase 3 will be going for 2 or 3 weeks, but we can shorten that if we are if we behave responsibly. Okay, what do you say, Dr. Thakur?
Definitely, we should depend on the epidemiologist and the government guidelines of this. Being prepared, again, I say being prepared means does not mean you take 4 months ration in your home and you feel safe. Not like that. There are certain social responsibilities you have to maintain. Please maintain that, and you build have your faith on the administration. You keep faith on the government. They will be taking care of you, and you keep in good touch with your family, your neighbor, and your friends. Because if anything arises, they are going to help you. Please don't get detached from the society. You are in physical isolation only, not in mental isolation. You call them, you make a WhatsApp, you check their health, you take the conditions, you make a chat with them, you make I'll say recreational things with them. Do it. Get in touch with everyone. Okay, this is going to help you in long run. Once the COVID virus is went off, then you will find the benefit of these social relations. Then will come. I am very much hopeful that due to this COVID-19, after this COVID-19, this social relation and bonding is going to be much stronger. There is a
Yeah,
question. This question is fine. Soti Thakur is asking, is it safe to collect essential commodities from online? Is there any chance of contamination? The answer is there is chance of contamination from wherever you count it. You collect it from the local shop, you collect it from the online, the risks are same. So you maintain your hygiene. You, whenever the thing comes, you take a plain cloth with sanitizer, you wash it, then you wash your hand, and then you make the sanitizer use of sanitizer like that. Then it will be safe. It is nothing that there is nothing special in this. You can collect it, no problem.
and also the thing is that regarding this question, I would like to mention ki, suppose you are going out for marketing some essential things and you are bringing that home. Don't immediately put it in that in into the fridge. Okay, you please all should be maintaining this, and in no media, if no one is talking about this, I have, at least I have not listened or heard of it. But suppose from online, whatever you are buying, you should keep that for some time, keep it aside, if possible, as per the nature of the thing, whatever you are buying. And like whatever you are buying from your nearby market, you should keep that for some time, at least for 24 hours. And after that, if possible, as per the nature of the thing, whatever you have bought, put it in fridge. Before putting it fridge, and always, if possible, while buying or going out, you should use uh, gloves. So that thing, actually gloves are very, actually we are not finding it, we cannot buy it right now because of scarcity. But if possible, if you are having gloves, use it while going out
Gloves
or
mean
buying
rubber
from the
gloves,
market.
not your winter gloves. Gloves mean
Yeah,
rubber.
here
I've seen people
disposable gloves.
wearing that woolen gloves in the market.
No.
Using it, you don't use it, is useless.
Yeah, it is disposable gloves. Disposable medical gloves are there. That is possible. It is thin rubbers. It is made of thin rubbers. Yeah, and we are uh, towards the end of the webinar. Thank you, attendees, but whoever attend. Actually, it is a very huge response on Facebook also. So many questions are there. We have tried most of the answering most of the questions, and it will be there on Facebook and other social medias also. If you have any other questions later on also, just ask there. We will be able to answer that in our spare time also. And Shilpi, Dr. Shilpi, thank you for coming on Facebook. And I thank Dr. Sudipta Thakur for being with us and for sharing his valuable knowledge regarding this topic. We would like to see you again on different topics in this webinar also. Okay. Thank you, Thakur, Dr. Thakur.
Thank you for inviting me. Thank you, Doctor.
Thank you.
Good.
Okay. Bye, everyone.